Hi, everybody. Welcome to the Meno Lounge. I'm Julie Gordon White, CEO of MenoWell, Menopause, Energy, and Protein Bars. Always excited to be here with you on a Tuesday. We have a really awesome guest that I met in October at all the menopause things in New York. And I'm going to bring up Dr. Anita right now. Let's see here. This is always a fun part. Okay, Dr. Anita, I see you. Hi, Sam. Hi, everybody. Super fun to see you. All right, here comes Dr. Anita. I know you probably can't hear me right now while she's coming up on stage. But if you can, hi, Natasha. We met, well, I think we were at Marvelous Mrs. Menopause event. And of course, the most fabulous Katie Fogarty of A Certain Age podcast introduced us. And it was, I'm going to send you that invite. There it is again. We just connected. And part of it is because we both have gray hair or silver. I think that was kind of fun. And I just love what she does. All right, here we go. I'm going to keep accepting. I'm not sure what's happening here, Dr. Anita. So I'm inviting you and pulling you up at the same time. I hope Instagram is on our side today. Maybe put in the chat if for some reason it says you are unable to join. I'm getting that message. You might pop out and here she comes. Here she comes. Hello. Oh, you got your hair cut since the last time
I did. Thank you. Thanks for noticing.
Yeah, absolutely. I did too, but not quite as much. So super cute. I was just saying how when we met, we both have our silver gray hair, so we're like, oh, I like your hair.
It's a small club.
Yeah.
It's a small club.
It's a small club. After I went gray, my friends I did in COVID, and then some of them said, "What, are you going to start coloring your hair again?" I'm like,
Nope.
No.
It's so great. It's so liberating, right?
I feel the same way.
Yeah.
Absolutely. Well, yeah. I'm so glad you're here, Dr. Anita. I want to say it right. Sadaty, is that right? Did I say it? Okay, good. You're an OBGYN, you're an integrative and functional doctor. You've been, traditionally in the space 22 years, and then you decided that you wanted to add this functional and integrative approach, which is what really attracted me to what you're doing. And so I want to talk about that. And we're going to talk about hormone replacement 101 kind of, but I said, sort of from a holistic perspective. So I really want to bring in your lens around that. So does that sound good?
Yeah, that sounds amazing.
I love it. Well, let's start. So you were, a regular OBGYN gynecologist, a regular, that's special,
yeah.
Not regular. Tell us about that journey to decide, okay, I want to bring in a more integrative and functional approach. And then we can talk about what that actually is, what that means.
Sure. It's great because I love explaining what this is about. I would say probably around 2011, there were two things that kind of came together that maybe moved me into the functional medicine integrative space. One was I myself was going through hormonal changes and feeling these incredible levels of fatigue that really weren't explained. Like everything's normal, you're fine, you're this, you're that. And I'm like, this doesn't feel right at all. Like I've never in my life sort of felt the need to I don't want to go to work. I want to run away from my family. I was like, I'm not having it.
Right.
So there was that. And I ended up attending a lecture from a functional medicine practitioner just randomly. And they were able to basically explain to me, what, you're going through stress hormone imbalance, your adrenals aren't great. This really comes to a head around perimenopause, and everything all of a sudden made so much sense. I got some reading materials, and then that's when I was like, wow, there's something here. The second piece was that really for women who were aging with me, my patients were in their 40s, 50s. They were also experiencing significant levels of symptomatology. And at the time, we really weren't in favor of hormone replacement therapy. But I was reading very different things, and I really realized, listen, if I can't give someone a birth control pill or Prozac, I've got nothing left.
Right. And we give women birth control pills, right? So that is just Okay, don't get me started. Okay,
Yeah,
keep going.
but just to your point though, what people don't realize is that, doctors are very comfortable prescribing oral contraceptives, but they're 4 or 5 times the dose of hormones that you would be taking in replacement form. It doesn't make
No,
sense,
no, it doesn't.
right? I mean, if you're talking about how do you bring safety first, that's not the way. But anyway, so when I realized, what, I need more in my toolbox, like this is not going to work.
Mhm.
And that's when I, found the Institute for Functional Medicine, and I started doing real education and teaching, and passed my certification to be a certified functional medicine practitioner, and did lots and lots and lots of outside study to
Yeah.
come to where I am now.
That's
So
amazing. And the fact that you were already an MD and then you decided, okay, I need this other layer to connect to maybe who you had evolved to as an MD. Hmm?
yeah. Well, once you start seeing the importance of lifestyle, nutrition, balancing hormones, looking at nutrients, looking outside the box, you can't practice just pharmaceutical medicine anymore. You
Mm,
really can't. Like it
mm.
goes against sort of what you know to be truly beneficial for patients. So it's really hard to only look at it through that lens.
Yeah. Yeah.
So
And that's to me the real definition of wellness is that when we're bringing in all those modalities
mhm.
to support a patient versus here's a prescription for this and here's a prescription for that.
Yeah,
I don't
yeah.
know. I'm not a doctor. What do you think about that?
Well, I think unfortunately the system is sort of rigged for that to be the way physicians have to practice medicine. They don't get a lot of time to sit down with their patients. They're certainly not taught in medical school the value of nutrition and lifestyle medicine. It's really all about diagnosis and treatment that is pharmaceutical.
Yeah.
That is really the mainstay. And doctors don't have the time, to be able to sit down and really dig into, well, what's going on with your life? Like, how are you eating? What's your exercise like? What's your sleep like? How do we optimize this? How do we fix your stress levels? And what to look for, in all
Yeah.
those arenas,
Right.
which, I love that you're bringing that conversation in with hormone replacement therapy, because a lot of times I think women may not be getting the full benefit unless they're addressing all those other lifestyle pillars.
Yeah, I agree with that. And of course, for me, coming from the nutrition lens, to me, I feel like that's our biggest lever. It's like the one thing that we can control is our
Mm-hmm.
nutrition. So we'll talk about that. But
Mm-hmm.
let's talk about being, functional and integrative. I know that there are pillars around that. I love that on your website. I read, your 9 pillars there. Can we
Mm-hmm.
just touch on, you don't maybe not have to touch on all 9 unless
Sure.
you want to,
Sure.
but what does that mean? Because I think women still get confused about the terms functional and or integrative. Are they the same? Are they different? And tell us about the philosophy.
Sure. Well, I think in general, integrative medicine, it's a nice term because it basically describes integrating many different healing philosophies and modalities, both things that are considered holistic, things that are more conventional, pharmaceutical. Like, you're basically trying to take advantage of everything that's available to
Mm,
make a patient whole.
mm,
Functional medicine is, I guess you could call it, sort of a subset of integrative medicine, where, yes, there isn't this staunch belief that, you can never use medication, because I don't believe that's true. As a matter of fact, you often need to use medication. But with functional medicine, we're looking for underlying causes
mm.
of conditions. So instead of, for example, saying you're depressed, you need Prozac, we're saying you're depressed, your blood sugar's not balanced, you're depressed, your B12 levels are really low, you're depressed, your gut is abnormal. And that's sending signals to your brain that are creating abnormal neurochemistry. Whatever it is, deficiency of testosterone. Like, we're trying to say, well, what is
Yeah,
it that's leading to this?
yeah,
What's the underlying cause? How do we correct that underlying cause, as opposed to just masking the symptom?
mm-hmm.
That's the biggest difference. I think functional medicine is all about what's the root cause, how do we address the cause in order to address the symptom from the bottom up.
I love that. So it doesn't necessarily just, we only suggest supplements. It doesn't mean that.
No.
It can mean all of the things. You're just looking at all of the different aspects of the of the experience that the patient is having to try to treat and support and shift versus just one thing. Yep.
Absolutely, exactly. That's exactly right. And it's different for everybody. You know, the symptom is how your body expresses it, but the underlying cause could be multifaceted, could be multiple variables, multi-layered.
Right.
So, you know, that's why it's so much more personalized and precision, because we're saying, okay, what is making this happen for you? And also where you end up expressing that symptom is often where your vulnerability might be.
Oh.
You know, some people might get, for example, you know, neck pain or foot pain or backaches or mood issues, you know, like, or fatigue, you know, whatever it is, like that symptom is sort of where their vulnerability might be. And that's very individual, right? Because like
when you say vulnerability, so does that mean that as an individual, we have different places that we're susceptible to express things, or tell us more about that? That's very interesting.
yeah, I mean, that's exactly what I mean. So in some cases, for example, let's just give something like that you're very well aware of. Let's say that somebody's eating a food that's inflammatory for them. Let's say it's a gluten or it's dairy or it's both or it's eggs or whatever it is. The way that will express in one person, let's say a migraine, versus where it expresses in somebody else bloating or constipation. Or I often, amazing, like when you get rid of gluten and dairy for some patients, that gets rid of their back pain or their knee pain or their tennis elbow or whatever it is. Like, so that's sort of where your body, where you have the vulnerability is where you express. So it doesn't necessarily have to be genetically motivated, but it could be. You know, it could be that's where your genetics are sort of most vulnerable. So that's where you express. So that's kind of what I mean. So that's why it's not like you can't say one for one. I have a stomach ache. Let me take my Lanta. That's not addressing anything. It's covering it up, but it's not saying, well, why?
Right.
Is it gluten? Is it a deficiency? Is it a hormone problem? Is it an infection? Is it H. pylori? Like whatever it is.
I love
so that's
that. I love that insight that that's your area of vulnerability, and then our work with your practitioner, if you have a good one like you, to figure out how you address that, and not just, I mean, it's fine if we want to, I guess, you know, you don't want to deal with it, so let's take something to get rid of the pain or the discomfort, but it's so beautiful. The body is talking to us if we're willing to listen, right?
It's telling us something. It's your messenger. What's going on. It really does tell you. As you know, when you sort of discover what the problem is, when you put someone on the right path in terms of their eating strategy and their nutrition, like what a difference that makes, right? It's so gratifying,
life-changing, especially during perimenopause and menopause, because so many things are coming at us at the same time. It's so confusing to decipher what and why. So it seems that an integrative practice would all the more reason to work with a doctor that has that multifaceted perspective to figure out and sift through all the experience we're having to figure out why it's happening and what it truly is about.
Yeah, and that honestly, where it came in handy a lot was in the 10 years ago, patients were really so suspicious of and fearful of hormone replacement. And there were so many women that really didn't want to address their health concerns with hormone therapy. And so that's where working on all the pillars and all the lifestyle foundation can get them to a similar place. It's just, it takes a lot more work. There's a lot more to do. There would be more, let's say, supplementation. You have to be much more committed and on point with nutrition and sleep and exercise and stuff. The hormone therapy just gives you such a leg up because it's very difficult to duplicate all of the myriad of things that estrogen does or progesterone does or testosterone does. Like, it's hard, to mimic that.
Yeah.
But that's not to say you can't, or that you can't get close.
Yeah. Well, and I appreciate you saying that. I just started hormone replacement therapy 7 weeks ago, and I'm 59.
Oh,
yes.
Wow.
I know, because that's how MenoWell came about, because my mom was of that generation no HRT, you know, so I didn't think it was an option for me. So I leaned heavily on nutrition to calm my body, lose weight, feel better, blah, blah, blah. But knowing what I know, hanging around all my favorite docs, like, you know, I'm missing out on the protective aspects of it. But it was still a big decision. You know, it took me 3 years of being in this space to make that decision. And I'm glad. Whew, what was I missing? I'm just saying. but I do the other things too. And I think that's important. And I'm glad you're saying that HRT is so important, but we have to do all of it to optimize. Yeah. So, nutrition, move our bodies, hydration, all those things. Okay. So let's get into what I'm calling holistic HRT with you. Can we talk kind of first off about the I knew someone was going to ask this right away. Is there an age when it's too late for HRT? Let's just answer a couple questions and then we'll jump in and talk a little bit about bioidenticals. So go ahead and I'll let you respond to that first.
So in general, ideally, if you would still get the benefits of hormone replacement therapy if you begin within 10 years of menopause. The reason being is that once all of the changes related to aging without hormones, without benefit of estrogen, once those things start to happen, for example, you may develop more plaque in the arterial vessels. There may be more blood vessel imbalance in the brain. Once those things have taken hold after so many years away from estrogen exposure, then the risks of HRT become a little bit higher, and you may not be able to actually get the benefits. And in some cases, there is some data to suggest that it could be worse for you to take it in some cases. I'll give you a specific example. One of the things that we get benefit from if we start hormone replacement therapy within 10 years, and if we use it for 10 years, we get protection against dementia.
So can I just qualify, if you go into menopause at 51 or 52, then you're okay to go up to 62. You're still in the 10 years. Because I think 60 starts to be that number where, for whatever reason, women are freaking out about starting. Correct. So 10 years from when you went into menopause, don't worry about the 6.
That is a more exact time frame. Okay. 10 years as opposed to 60. Now, it often ends up being similar. Right.
Close to that. Correct. Yeah.
Close to that. Now, you also have to use, like I said, the hormone replacement for 10 years. But for some women, if they use hormone replacement therapy after 10 years have passed, there are some studies that show an increased risk of dementia. Now, what is that exact number? And does that nullify every other benefit you might get from hormone replacement therapy? Not necessarily. It has to be very individualized. I do have patients who have chosen to be on hormone replacement therapy even after 10 years for different reasons. Okay. And so I think it has to be a very, individualized conversation, but as a general rule, that would be something. 10 years is a good time frame.
I've heard Dr. Sharon Malone and Dr. Mary Claire, both say, I'm going to the grave with my patch. I don't care. I know Sharon says all the time, I've been on HRT for 15 years. So it's individual decision.
Well, that's another question a lot of women have. Like, well, how long am I going to be on this? Right. And the answer is, it's very funny because as soon as you want your dry vagina back and you don't want your bones protected and you don't want your brain protected and you want to go close to a heart attack, then you want to stop it. You really don't. You want to maintain those benefits moving forward. Having said that, a woman can make her decision to stop it at any time. If something comes up in their health or they're not comfortable or it's not working for them or whatever it is, you can stop. Right. Sort of no harm, no foul. But if you're deriving benefit, you want to stay on that.
Yeah, that makes sense to me. And progesterone, sleep. Why didn't I have that 10 years ago? No one talks about how progesterone makes you sleepy. It's so
nice, right? Not only that.
What? Go ahead.
Not only that, it's amazing for joint aches and pains. Amazing.
That can just be no brainer of,
It,
I don't know. It's
there's
very,
also a role of progesterone for things like libido. Like, progesterone is sort of this unsung hero in the hormone replacement equation. A lot of people don't realize that it's so important to balance the estrogen, that the way the receptors interact with the hormones, it creates balance at a cellular level when both of those hormones are acting in concert.
mm,
But progesterone by itself has so many wonderful benefits in terms of things like less acne, some libido, better sleep, deeper sleep, muscle ache and pain reduction. Also, I've had patients with allergies get improvement when they're on progesterone. So there's some very interesting things that you get when you take progesterone. So for women who are hysterectomized, where they say you don't need it, in some cases it may be necessary. It's not 100%, but it may give you value that you don't
right.
recognize.
Right. I like it. I think it's my favorite thing now.
Yeah.
If
That's
I
where you
for,
noticed the biggest change when you started
yeah,
for the
yeah. I
progesterone.
mean, I got from the estrogen, brain boost, clarity, and then an energy, a little bit of extra energy, and then that sleep from the progesterone. I'm like, hello.
Mm-hmm.
It's like my new BFF.
Yeah.
Um,
I see
okay.
a good question here, by the way,
Yeah,
about
go ahead. Which
if
one?
you're on hormone replacement therapy, should you stay on estradiol vaginal cream? So that's a very good question.
Yeah.
25% of women who are on HRT still have vaginal atrophy symptoms, things of dryness, painful intercourse, overactive bladder, UTIs, that kind of thing. So a quarter of the women who are on HRT should continue to take vaginal estrogen. So you can always stop it and see if you need it or not. But for a pretty sizable number, they need to stay on it.
Yeah, that makes sense. Um, I know Natasha asked, when is it too early to start hormone replacement?
So that's definitely a trickier question because in the perimenopause, which is a good 10 years before you hit menopause, and that may begin in your mid to late 30s, early 40s, mid 40s. It really varies. But I think that what I like to do with patients is, number one, assess their symptoms, because you do get hormonal decline when you get into perimenopause. Estrogen and progesterone can fall, as can testosterone. So all of those should be assessed and measured. But in some cases, the primary problem in perimenopause is usually progesterone deficiency and or testosterone deficiency. That's usually what begins. So oftentimes I have women who are in perimenopause balancing their hormones with additional progesterone or testosterone. That doesn't mean that estrogen is never necessary. It is. You can start getting estrogen deficiency symptoms as well in perimenopause, and some women will need to go on that. What becomes tricky in perimenopause is that the output of your hormones in perimenopause is incredibly variable. Like, you cannot say today could be different than tomorrow, could be different than next week, than next month, whatever. So that's where women have to be very educated about what the different symptoms are of too much estrogen, too little estrogen, too much progesterone, too little progesterone, etc., because their hormone needs would change. So
Yeah.
it's not as easy as in menopause, where you're not making anything. So what we give you is
Just,
what you're getting.
just put it on there. Yeah,
Yeah,
because when you have all those fluctuations, it makes it so difficult. Mm.
exactly.
Well,
Exactly.
and all the more reason to add an integrative functional doctor to your, what I would call the success team, because you need somebody who's going to spend more time with you
Mm-hmm.
as you're going through all these things versus a 10-minute in, out, try this kind of situation. It's just going to
Yeah.
be too frustrating.
Yeah.
Good. Well, we'll talk at the end about
Yeah.
how people
Yeah.
can find you.
Absolutely.
Um, okay, so let's see. Here's a question. If you're 44, already using HRT in peri, can you keep using it? Okay, so we did talk about that. I just want to make sure we didn't miss anybody else here. Some good questions. Okay, let's hop into, we'll come back to find some questions. So because holistic, integrative, functional, this leads to confusion around what what's the difference between bioidentical and non-bioidentical? The whole thing is so confusing. So
Mm-hmm.
can you shed some light on those definitions so women can understand?
Sure. All bioidentical means is that the hormone that you're taking is the exact same structure as what your body produces. So women produce three types of estrogen: estradiol, estrone, and estriol. They produce progesterone, not medroxyprogesterone, not norethindrone, none of that. It's progesterone, and testosterone, not methyl testosterone, not like weird form. No, that's all it means. It doesn't mean that it comes from a yam. It doesn't mean you can't get it at a regular pharmacy. It doesn't mean it has to be compounded. It doesn't mean it has to be in a cream form.
Because that's what gets confusing. Wait, bioidenticals, you can only get them if they're compounded. Not
Correct.
true. Correct?
Correct.
Okay.
Correct. Even the compounding pharmacists don't like that. That's the confusion. They're like, no.
It's like a leftover from the Suzanne Summers days or something about compounding.
I think so.
What do you think? Yeah.
I think so, because, really, I don't know, there wasn't the option.
Right.
Back then, you had Premarin, right? You had birth control pill, you had norethindrone, you had Provera. You didn't have these natural forms. They had to be compounded. But so that's all it means. So can you get it from a regular pharmacy? Yes, you can. Can you take it as a pill? Yes, you can. Can you take it as a patch? Yes, you can. Can you do it as a gel? Yes, you can. So that's all it means, that the structure is what your body understands.
Got it. And there's still non-bioidentical hormones that are being prescribed. So doctors that are not functional or integrative can prescribe bioidentical hormones, right? Like the estradiol patch, right? That's bioidentical. But then there's also remedies that are not bioidentical, correct?
Correct.
And
yeah. So there are.
They're still being prescribed also.
They are, but I think much fewer and far between. I think probably very, very old time, physicians may still feel comfortable because that's what they used to prescribe all the time. But nowadays, because the pharmaceutical companies are aware that women are really wanting bioidentical forms, they don't want synthetic, sort of bastardized forms of hormones. They're with it. So most of the products that are coming out are bioidentical for conventional doctors. So, and it's very easy to figure that out. Like, on the patch or it should say estradiol. If it says estradiol, it's bioidentical. If it says progesterone, micronized progesterone, it's bioidentical. The only thing that we don't have for women, and as a pharmaceutical, like a regular pharmacy option, is testosterone.
I know.
That you have to, there's some machinations around that, but that usually has to be compounded, although you can play around with androgel for men. It's a little sloppy. It's not very exact, often not covered.
1/10 of the, but that.
I'd rather just do a compound that I know what you're getting.
Yeah, that seems like a better, safer option. Okay, so let's talk a little bit. Let's see. Somebody asked about yams. I love it. There's always going to be a question about yam. What is wild yam bioidentical? Let's answer that, and then let's talk about formats, because there's so many formats and different perspectives on which are optimal. So let's go to yams first.
Look at yam, because that's always the the big bioidentical confusion. There are some over-the-counter, mainly over-the-counter, not prescription strength, varieties of very mild doses of hormone that can be derived from yam, but it's often so low that it doesn't necessarily create a therapeutic response. And that has nothing to do with it being bioidentical. So everything, even from a compounding pharmacy, they're not making it from a yam. Like, they're making it from, product that creates the steroid that your body recognizes. Estradiol, testosterone, progesterone, DHEA, whatever it is. It's the same structure. They're not getting it from yams.
But isn't
So
it amazing? I mean, this is what we make up in our minds that, oh, it's bioidentical, it's natural,
right.
therefore it probably comes from a
Well,
yam, like,
I
right?
think it's
No.
amazing marketing. It's
Yeah.
great marketing on the
Yeah.
part of people that make yam cream, you know?
Yeah. Oh, okay. Yeah,
So
yeah, yeah.
yeah.
Excellent.
So,
Because,
but if
and
you
it goes
wanted to
back to
know,
the choices. We didn't have any choices for so long, so we're just making it up as you go. So,
yeah, yeah,
mm,
exactly. But yeah, now we have lots of choices, lots of options, lots of areas we can get it from, and know what you're getting, know the dosing, very safe, very consistent. Like that's what we want.
excellent. All right, good stuff here. Okay, let's talk about formats. So we have pills, patches, gel,
Hmm. Yeah,
creams, gels, sprays. I
yeah.
like the idea of a spray, but that didn't seem exact enough to me. Like, where's all that extra stuff go? Same thing with cream. Like, I like the idea of that, but then right, wrong. So I personally settled on a patch, which I'm having a little struggle keeping that thing stuck where it's supposed to. Probably because it's too close to some 3 baby stretch marks that I have or something.
Well,
What are your
you
thoughts?
could put that on your back.
Can
You
I
could
put it
put that
back
on your.
here?
You
Yeah.
can.
And
Yeah.
how
Good try.
does it need to be lower or higher? Does it matter? I mean, I guess I don't want it
I
up
mean,
for
I think
sure.
wherever it won't be uncomfortable, but yeah, it's usually like sort of below the belly button on front or the back.
Yeah.
You could do. Yeah.
Okay.
Give it. I mean, that might be easier,
I'm gonna try
but
that.
it might work better.
I also like a
But
really hot shower. That's probably not very good for the adhesive. So
they,
on the
they stick pretty well. I
oh,
think. I mean,
okay.
my patch does. It's
Weird.
hard. I have to scrape that thing off. But I'm also a huge fan of the patch. It really has incredibly consistent levels of dispensing. So I really like that. It's sort of other than being, if you have a allergic reaction to the adhesive on the patch, it typically 99% of the time it really sticks well. Sweating, swimming, showering, it usually is no problem as long as you put it on when the skin is dry, like clean, dry, and then don't, not moisturize, like put it on in the right way.
Yeah.
So I'm a big fan. And so transdermal is what, through the skin, is what most practitioners want to give patients because that bypasses the liver. You don't make any clotting factors. And so some of the concerns related to hormone replacement therapy and increased risk of stroke or MI are essentially gone when you do a transdermal formulation. And the truth of the matter is if women are within 6 years of menopause, oral estrogen is not going to cause a clot either. It
Mm.
has to do with that time away from menopause that increased the chances that a little bit of increased clotting factor could have been like the last nail in the coffin to create a clot or something. But that's why most people like transdermal, because we avoid any kind of blood clot risk. But it's not for everyone. And so I do have some patients that if they don't like the topical gel that comes out of a little packet, you can squeeze it on. I don't know if they have anymore. There used to be a pump mechanism estrogel, but I don't know I haven't seen that lately. And then the mist is just like a pump action as well that sprays a mist on your arm to absorb. I think all of those have, you have to let it dry. It has to be out in the air. It's like, it's a little bit, who has time for that? I can't sit there naked for 10 minutes, like waiting for something to
Waving
dry.
your waiting for it to dry,
Waving this
or if
for
you put it
10
on your
minutes.
leg, you can't put your pants on, or your
Yeah,
leggings, God forbid.
it's just
Right.
not convenient,
Right.
so
Right.
if you can do a patch, that's helpful. Creams are also better in that regard because you can just rub them in. If you do a bioidentical cream, you can rub it in. You don't have to wait for it to dry. It goes right into your skin. So that could be an alternative for some patients. And oral estrogen as well. Progesterone, for the most part, we like to take advantage of, like you're mentioning, the sleep inducing effects, the relaxing effects that only really happen mostly when you do the oral.
Yeah.
You can get some benefit through the cream form in terms of relaxation, but it's not necessarily as dramatic as with the oral pill. And some people have concerns that we may not be getting enough of a level with the progesterone cream because it's such a big molecule that we're not getting enough protection at the uterus to prevent bleeding and precancer and uterine cancer. Because if you were, there is theoretically a risk of uterine cancer if you only used estrogen without progesterone for years or months or whatever, without the opposing balance. So, I personally, if a woman needs to be on a cream, I'm a little more vigilant about looking at their endometrial lining every few months or at least twice a year to make sure that they're not developing any thickening in the lining, because there aren't studies that show the safety in terms of protection against uterine cancer with cream forms of progesterone. It's really only
with
been done with oral, or in some cases, if a patient can't tolerate progesterone. There are patients that don't do well with progesterone. I don't understand that. Like, it doesn't make sense to me, but
I'm so sad about that.
It's just a thing, right? But in those women, sometimes they'll get a progesterone-coated IUD so that they don't have to take progesterone. So
we're so complicated, but it's worth it, right?
So complicated.
But
I
keep fighting for ourselves.
And they're a lot easier.
Yeah, exactly. So simple. Men.
Pretty much.
But we're worth it. We're worth it to keep advocating for all of these different little pieces, these nuances of our bodies, just to, live optimally. We're in the best time of our lives. I have 3 kids out the door living their own life over there, and more time with my husband, more time to work on my passion around the business and menopause and women. And we all deserve to feel amazing while we're doing it, not just going through this second half of life slogging because our brain fog is just so intense, or because we didn't sleep, or we feel bad because we feel uncomfortable with extra middle, like all that. We don't have to have that. So I really appreciate what you're doing and how you went for extra education to really meet women in a personalized way. I think that's really how I see what you're doing. It's so personalized.
Oh, I thank you for that. But it's so gratifying to really get all the pieces of the puzzle together. And like I said, like you've mentioned too, it's really just, if you can look at everything and optimize everything, if you choose hormone replacement therapy after menopause or even perimenopause, it just works so much better.
Yeah.
If all the other things are addressed. Right. So, yeah.
So good. So I bet you have a few tips for women that you want them to know to have a better experience as we pull all this together. And I hope you'll come back again so we can dive deeper into lifestyle medicine. What do you think about that? Yeah. I haven't heard that term before. It's awesome.
Yeah. No, I love it. Well, actually, I'll bet you are very familiar with this regarding all the time that you spend treating women who are not interested in hormone replacement therapy with diet. One of my top tips is get your blood sugar balanced, right? Optimize your protein. Don't let the ups and downs. You become more insulin resistant when you lose your hormones, and therefore blood sugar instability becomes the triggers for hot flashes and night sweats and insomnia and irritability. So that's kind of a really big tip. If you can balance your blood sugar, the hormones are going to work a lot better.
So just going in that a bit, that is when we're making our food choices, making sure that we have a protein, a fat, and fiber. So even if you're eating something with a little bit more sugar, it's not going to spike. I mean, that's something that was really important to us for MenoWell, that when women eat a MenoWell bar, they just get this nice little curve. There's no spike because of the balanced macros when we talk about macros, right? So having that fat, fiber, and protein, that really goes a long way to help with that. Yeah. Balancing that blood sugar.
Yeah, exactly. That is how I used to really treat a lot of hot flashes and night sweats, was through, balancing blood sugar and optimizing protein and fiber. So thank you for the bar.
Really good. Thank you for liking it. I think when I met you, you're like, I need to take this before I make sure I like it. I think that you say that.
I had to approve it.
Right.
Percent. I love it. So helpful,
I
so
love it.
helpful. Such great feedback, from my patients. So keep up the good work. The other thing I wanted to mention, so let's say tips. The second tip, for some women that are not getting relief of vaginal dryness or painful intercourse with either hormone replacement therapy, or even if they're adding in vaginal estrogen,
Yeah.
they may want to consider testing their nitric oxide levels and taking nitric oxide as a supplement to improve blood flow, oxygenation, helps libido, helps brain, helps heart, the whole thing. Nitric oxide, which drops after age 35, is highly associated with sexual dysfunction.
I
So,
have never
yeah,
heard anybody say this before.
yeah,
Nitric
nitric oxide.
oxide.
Yep,
Wow.
yeah.
Okay.
It's a big game changer, and it's also very helpful for libido. So that's
Wow.
another tip that I like to mention to patients.
So you get it. There's a test for that.
Yes, you can get test strips for nitric oxide,
Mm.
and it's usually from the companies that make the supplement, which are typically derived from beet juice extract. But you can test to see if your nitric oxide levels are coming up once you've started the supplement. And when your levels are in target zone, because you'll see it has difference, like a beautiful fuchsia color. It's just like one of your bars.
Mm.
When it's at that color, that's when patients start to notice the difference in terms of either libido, focus, arousal, dryness, like all those things start to get better.
Wow. And so the question is it a urine test or is it? It's not a blood test. I
It's
know
a
that.
saliva test. It's like a
Saliva.
stick. Yep, it's a
Yeah.
stick. You wet it with your saliva, and then you look and see, what the color changes. So,
Like ketones.
yeah.
And health coach Angela says pre-workout. So is that a pre-workout? Do you use that for a pre-workout, Angela? Tell me what you mean by that. So, okay.
I could imagine that would help actually,
Huh.
but it gives you a sustained level. So I don't know that it's necessary right before a workout, but so that's where we use it. The other thing that I wanted to mention is for women to check all of their hormones, like not just estrogen, progesterone, but when you're doing blood testing, make sure you're checking your testosterone, your DHEA, which is your adrenal hormone, which also has benefit in terms of balancing estrogen and testosterone, and check your thyroid, all the hormones of the thyroid. All of those things interact, and they all help to create symptom-free, like as far as metabolism, as far as thinking, as far as energy, fatigue. Like there's so many aspects and they're all interrelated. So I encourage people to check all the hormones instead of just, estrogen, progesterone.
Those are the ones we think about. So
Those
you're
are the
making me
ones
think
to
about the Dutch test. There's some people, like some docs are like, don't do the Dutch test, not necessary, waste of money. Others, yes. So thoughts on that? Because it seems like a lot of the hormones you're talking about are part of the Dutch test, yes or no?
I'll tell you one of the things that I actually do like about the Dutch test for women that go on hormone replacement therapy is that it measures the breakdown products of estrogen so that you can see if you're processing the hormones that you're receiving. Are you processing them in a safe way? There are certain breakdown, yeah, there's certain breakdown products that can be more toxic to the cells, for hydroxyestrogen breakdown products, for example. And so the Dutch actually tells you whether you're metabolizing it in a pathway that could be a little more, toxic. So I love that about the Dutch. I also find that as far as adrenals are concerned, I at this point in my career don't really feel like I need to treat adrenals. I think adrenals are really a symptom of other things being off. So, but there's so many women that really want the Dutch test. They feel like it gives them a huge overview of all the hormones, the cortisol, the DHEA, the testosterone, the estrogen. Is it necessary for hormone replacement? Absolutely not. Is it a nice extra? Yes, it is. So I don't malign it, but I'm also not, everybody needs to get it. It's always helpful. It's always helpful information.
Information.
Yeah,
Excellent.
it's more information. So let's
Okay,
see.
that's good. I like it. Someone just asked, is this going to be recorded? Yes, it'll be saved on our page at My MenoWell here on Instagram. It will also be on YouTube at, I guess, My MenoWell. I should think, Meno Lounge
We can
Talks.
post it on my website
And
too.
then I'll add Dr. Sadaty as a collaborator, and so we can share it. So yes, and this is such a powerful conversation. So if you're coming in late, make sure you start at the top because you're going to learn a lot. Okay, what else do you got over there in your drawer of tips?
I also am very big on this. So anybody who's going to be on hormone replacement therapy has to be very aware of their ability to detox. Okay, so what do I mean by detox? It's very simple. Are you pooping every day? And is your poop like meaningful? And are you hydrating appropriately? Because you want your kidneys and your intestines to be able to process out excess hormone that your body doesn't need or is trying to get rid of. And if you're constipated, if you're not going every day, if you're not hydrating, you're not allowing those two mechanisms of elimination to work for you, that's when we can start getting side effects and, you know, possibly down the road exposures to excessive hormone that is not going to be ideal for us. So I don't want people to
dropping
forget
these things that I have never heard anybody say.
Oh, good.
I love it. I mean, yeah, that makes perfect sense.
That's functional medicine. Yeah. Like you have to think about those things.
Wow. Okay, so make sure you're drinking here's my big old thing of water, right? Keep it moving.
I love it.
Literally. Keep it moving. Okay.
I love it. Yeah.
Okay.
And what's one other thing? I think the last thing I wanted to share, because a lot of women, our age group who have found weight loss resistance to be this really unending challenge, and despite everything that they're doing everything right, and they've done, all they can, all the things. Sometimes that last 10, 15 pounds, whatever it is, like a lot of women are turning to the GLP-1s, the Ozempics and the Manjaros of the world. And, I actually feel that for some of those women that are in that boat, that's been the only way that they can lose weight. I think that is because their brain set point has been unfortunately hijacked to stay at this very high level. And no matter what you do, your body will respond by trying to get you back up to that weight, whatever that set point is. And that's honestly one of the hugest reasons that these medications like Ozempic and Mounjaro can overcome a set point problem. But the tip is that women who are on those medications do better, lose more weight when they're on hormone replacement.
Wow. So yet another 1-2 punch, right?
Yeah. I mean, it's so common this day and age. And so how does hormone replacement therapy fit into that? It only augments the benefit. So yeah.
Huge. I know we've been talking a lot about it because it is helping a lot of women, and they just need to make sure that they are making the lifestyle changes along with it, right?
Exactly.
The usual suspects of protein and fiber and strength training.
Yeah.
So we don't lose that muscle along the way.
Exactly.
I love that you talked about the set point because I'm a big mindset person also. And are there holistic ways that you believe that we can shift that set point of that, that upper weight outside of Ozempic or, GLP-1s, or do you think that it is biological and we're kind of stuck there?
I actually don't think it's genetic, if that's what you mean by biological. I don't believe that. And the reason I don't believe that is because for our genetics have not changed in the last 100, 150 years. They haven't.
Wow.
But the rates of obesity have gone crazy. So it's not genetics that have shifted the set point. I think the set point has shifted because of endocrine disrupting chemicals in our environment and toxic chemicals in our environment. I think that somehow has created an environment where our body feels that we're in danger. And therefore, we need to hold on to reserves and resources in anticipation of dangerous times ahead. I think that again, I'm sort of almost like, you know, making it almost like a humanistic thing, but I think that the toxins in our environment are somehow responsible for these changes in set point. Because we all know back in the 50s, 60s, 70s, we didn't have this weight issue. Like, I'm
Right.
sorry, there wasn't
Right.
40%, 50% obesity in all the state. Like, it wasn't. So it can't be genetic.
Yeah.
It really can't. You know, yes, there are certain people that have genetics that may tend towards that, but I think as a population that hasn't changed. Whatever they were, if that was 10% of the population or 15, it can't be much different.
Right.
But there are other forces that have shifted the set point. So in answer to what do you do outside of Ozempic and Manjaro, like, I think that really working on reducing toxic burden in your environment, in your water, in your food, in your air quality, I think in your personal care products, I think that is massive. And identifying if you have a toxic burden that you're not aware of, and that's where functional medicine can actually do specialized testing to look for things like that. And I also, the second thing that I think shifts the set point is related to the gut brain axis and the communication between the gut and your microbiome and the brain. And there are some companies that do have probiotics. Pendulum actually is one that has, they are trying to shift the microbiome in such a way that it actually naturally starts to activate the GLP-1 receptors in our body. So I think that if you can balance and shift towards a more beneficial microbiome in your gut, that may have some influence over the brain set point as well.
Wow. Okay, you just said so many things in that last little bit. Like, I can't keep you all day, but I would like to.
I'd love to. It's my favorite.
Yes, so oh my gosh. Okay, well, we'll have to have a part 2 and a part 3 of this, but so powerful. Our bodies are so magical if we understood them better. You know, we don't understand our bodies well enough. We treat ourselves as like like one size fits all of everything. And it's so cool. That's why our clinical nutritionist, Barb Sobel, talks a lot about continuous glucose monitor, which is like another peek inside your body, what's going on. Really cool.
That is such an amazing intervention. It's really worthwhile if people have not done it. It's so illuminating.
Yeah, and it goes right to your tip number 1 about balancing your blood sugar, and you really understand, because some people who, you know, love a good oatmeal like me, you know, but sometimes that can, if you don't eat it with the right things with that oatmeal, it might not be your friend, you know. So really understanding that. So good.
Unfortunately, oatmeal's a dessert. It is a dessert.
So sad.
I know, it's sad. It's sad.
That's why we like it so much. Right. I know. I really moved to shifting of not eating gluten, you know, in the morning, having a more savory, going back to the egg situation, which I love my steel cut oatmeal with protein powder and blueberries and flax and chia, like all the good things. It feels like such a power bowl, but it's a little bit later.
Correct. So. Exactly. Yep.
Okay. So question, what does menopausing well mean to you? MenoWell, you know, it's our brand name, but it's really, you know, the way we feel about menopause. So what does MenoWell mean to you?
That's a really good question. I think it's you know, giving yourself the space to put yourself first, to prioritize your health and your well-being for once. You know, taking advantage of the wisdom that you have with all of these years of living and experience, and really starting to enjoy and flourish. And, you know, we are all, I think, as you know, as Katie has talked about, Katie Fogarty, like, we're all in this sort of second act, and it's hopefully going to be better than the first. You know? So that's what menopausing well means to me. Like, you're just finally sort of stepping into your power and your wisdom and like doing it right.
I love it. And when we have you as part of the success team, we can optimize all those little pieces that we might not be paying attention to, just to make us feel so much better.
I hope. I hope so.
For sure. On that note, how do we find you? I know you do telemedicine
Yes,
and you're in New York. And next time I'm in New York, although we'll be talking hopefully a lot more throughout the year, but we're going to
I
hang
hope
out
so.
some more time when I'm in New
Yes,
York. But
that would be great, Julie.
how do women
So,
find you? Yeah.
so the first step might be to peruse my website. It's drsadaty.com, DRSADATY.com. I also have an Instagram. This is Dr. Sadaty, so just some helpful tips here and there. My office is in Roslyn. I do see patients. I love seeing patients in person, but we also do telemedicine. And we have all sort of various options for meeting you. Some things are just fully functional medicine, some are gynecology, but with this integrative, I call it integrative gynecology. Most people don't know what the heck that means, but to me it means that I'm integrating my functional medicine background with my conventional medicine and kind of meeting people where they're at. Not everybody wants to be full on holistic, not everybody wants to be full on pharmaceutical, so let's see where we can kind of meet in the middle. We have a ton of fun things in my office, like drips and things to make you pretty. And
I saw that.
like
You've got all kinds of things going on there. I'm
it's so
definitely
much
coming
fun.
on this.
I wish I could do some of this stuff. I'm too busy.
I know. What is that? Cobbler's kids have no shoes, right?
That's right. Oh, that's right.
I
I'm in
love
dire
it.
need of a pap smear, so
Oh,
there's that.
well, I can't help you with that, but I'm sure you can find somebody who can. I am a nutrition.
I'll
I don't
figure
do
it.
those such things. I love it. Well, I am so honored to know you, and we have to thank Katie. When I'm in New York, let's all go out to lunch and thank Katie for bringing it. I just feel like we have so many synergies. I love the idea of pulling on all of these lifestyle levers, and then you're practicing medicine to me the way it should be. That combination of pharmaceuticals, traditional approach, and integrative. I put integrating the functional side of things because that's treating people. That's what wellness is. So hopefully we can move towards that, and you can just lead the way. How about that?
Oh, thank you, and thank you for everything you're doing, and thank you so much for having me on here. This is great.
So glad, so glad. All right, well, to be continued. So happy holidays to you. Thanks everybody for being here and asking great questions. And if we didn't catch your question, drop it in the post below and tag Dr. Anita, and then she'll probably maybe come back and answer if she can. And if not, we'll save them for the next round. So thanks everybody. Happy holidays. I'll be back on with our team on Thursday. We have our third annual holiday party on Meadow Lounge where we bring on our team and just talk about silly things. So hope to see you back then. So Dr. Anita, be well, and we'll see you soon.
Okay.
Okay.
Happy holidays. Thank you so much.
Okay. Take care. Bye everyone. Bye-bye.